Let's practice NCLEX questions.
A nurse is teaching a client about taking antihistamines. Which information should the nurse include in the teaching plan? Select all that apply. A. Operating machinery and driving may be dangerous while taking antihistamines. B. Continue taking antihistamines even if a nasal infection develops. C. The effect of antihistamines is not felt until a day later. D. Do not use alcohol with antihistamines. E. Increase fluid intake to 2,000 ml a day. Answer A, D, E. Rationale. Antihistamines have an anticholinergic action and a drying effect and reduce nasal, salivary, and lacrimal gland hypersecretion, runny nose, tearing, and itching eyes. An adverse effect is drowsiness, so operating machinery and driving are not recommended. There is also an additive depressant effect when alcohol is combined with antihistamines, so alcohol should be avoided during antihistamine use. The client should ensure adequate fluid intake of at least 2,000 milliliters, about 8 glasses per day, because of the drying effect of the drug. Antihistamines have no antibacterial action and are not used to treat nasal infections. The effect of antihistamines is prompt, not delayed. A nurse instructs a client with allergic rhinitis about the correct technique for using an intranasal inhaler. Which statement indicates that the client understands the instructions? A. I should limit the use of the inhaler to early morning and bedtime. B. It is important to not shake the canus. C. I should hold one nostril closed while I insert the spray into the other nostril. D. The inhaler tip is inserted into the nostril and pointed toward the inside nostril wall. Answer C. Rationale. When using an intranasal inhaler, it is important to close off one nostril while inhaling the spray into the other nostril to ensure the best inhalation of the spray. The use of the inhaler is not limited to mornings and bedtime. The canister should be shaken immediately before use. The inhaler tip should be inserted into the nostril and pointed toward the outside nostril wall to maximize inhalation of the medication. The nurse is evaluating the effectiveness of a teaching plan for a client recovering from an upper respiratory tract infection. Which is an expected outcome of the plan? The client will A. Maintain a fluid intake of 800 milliliters every 24 hours. B. Have a temperature below 100 F37, 8 C. Cough productively without chest discomfort. D. Experience less nasal obstruction and discharge. Answer D. Rationale. A client recovering from an upper respiratory tract infection should report decreasing or no nasal discharge and obstruction. Daily fluid intake should be increased to more than 1 liter every 24 hours to liquefy secretions. The nurse teaches the client how to instill nose drops. Which technique is correct? A. The client uses sterile technique when handling the dropper. B. The client blows the nose gently before instilling drops. C. The client uses a new dropper for each installation. D. The client sits in a semi-Fowler position for 2 minutes. Answer B. Rationale. The client should blow the nose before instilling nose drops. Instilling nose drops is a clean technique. The dropper should be cleaned after each administration, but it does not need to be changed. The client should assume a position that will allow the medication to reach the desired area. This is usually a supine position. The nurse should include which instruction S in the teaching plan for a client with chronic sinusitis. Select all that apply. A. Avoid the use of caffeinated beverages. B. Perform postural drainage every day. C. Take a hot shower in the morning and evening. D. Report a temperature of 102 F38, 9 C or higher. E. Limit fluid intake to 1,000 ml per 24 hours. Answer C and D. Rationale. The client with chronic sinusitis should be instructed to take hot showers in the morning and evening to promote drainage of secretions. There is no need to limit caffeine intake. Performing postural drainage will inhibit the removal of secretions, not promote it. Clients should elevate the head of the bed to promote drainage. Clients should report all temperatures 1004 F38C because a temperature that high can indicate infection. The client should increase, not limit, fluid intake. A 24-hour fluid intake of 2,000 to 3,000 ml would be appropriate. Thank you. Visit my channel for more practice questions.